purpose of developing the Drug Information Center is really about getting the clinical information from the top of the organizations and facilities we deal with down to the ground level, down to all the nurses and other health professionals that work in that building.
Diamond's Drug Information Center was created to provide up-to-date, evidence-based clinical information to those who utilize Diamond Pharmacy as their provider.
The Drug Information Center was created by Diamond Pharmacy to fill a gap or a need in correctional medicine.
For many years, the pharmacy community has done a great job at providing prescriptions and filling those prescriptions. However, as the medicines have gotten more and more complicated, what we've noticed is that there's a big educational element that is missing.
The overall mission of the Drug Information Center is to bring our pharmacist drug expertise to any provider.
The services that Drug Information Center provides in general are, again, direct relationships with providers, nurses, other allied healthcare professionals to the customers and clients we service. We are offering drug information via email, via phone. We're able to handle questions related to pharmacokinetics, pharmacodynamics, helping providers come up with the best disease state regimens.
So we answer all kinds of questions. Questions of drug stability, drug dosing, temperature excursions, how to order a correct medication, maybe perhaps even bridging computer systems between Diamond system and the facilities.
A large area of our expertise goes into cost-effective drug management, providing the best possible care for the patients without sacrificing the cost in a budget-friendly way.
We work to offer different webinars to our clients that they can view on various disease topics or treatment topics. Additionally, we also offer an on-demand pharmacist, so they're able to call in, the client's able to call in whenever they would like and get up-to-date clinical information. You're no longer seeing pharmacists as just dispensers anymore. You're seeing them more working in a clinical team, rounding with physicians, working in outpatient facilities, actually managing the patient. So it's really becoming more than just dispensing. It's becoming a more global healthcare provider.
Healthcare is challenging enough for practitioners to make diagnoses and deal with, real life, real-time problems, that to have all of the reference information as to the correct strength, frequency, duration of therapy is challenging, and we're here to offer a relief from that.
Diamond accomplishes this mission by providing clinical pharmacists with varying degrees of practice backgrounds, education, and expertise.
Several of us have had acute care experiences, some have retail or community-based experiences, and some with long-term care experiences. And I think that, in conjunction with some even postgraduate training and some certifications moving forward, has allowed us to gain the knowledge we need to service our patients, particularly here in a correctional environment. I think the clinical pharmacist's role in corrections specifically is very important. The correctional patients in general have the same disease states, for example, hypertension, diabetes, asthma, and so forth, that the patients in our community have.
Specifically in the prison population, we see more mental health situations than we do in the general population. As outside of general psychological conditions, we also see a rise in infectious disease such as HIV and hepatitis C. The majority of times patients are complex cases and require complex analysis of their case.
Unique to corrections is that security is paramount. So if an inmate is classified and they can only have a certain amount of medication administrations, it's our job to work with the providers to see how that could be best administered safely for the patient and safely for the institution.
Overall, healthcare in corrections can benefit tremendously from the incorporation of a pharmacist. Pharmacists have a unique knowledge of pharmacokinetics, pharmacology that other healthcare professionals don't. And they're also routinely problem solvers. So for unique patients, they can bring a unique perspective or a different treatment option that people normally wouldn't think of. I really think the most valuable aspect of the Drug Information Center is adding that additional clinical professional to the healthcare team. The ability for that physician or nurse to contact a pharmacist that's available for them is profoundly impactful on the care for the patient.
We have dedicated clinical pharmacists that are available typically Monday through Friday on a weekly basis, but our providers can use the phones, they can use emails. We have networking abilities to interact with them on a daily basis, and we can help improve patient care literally at the time of medication decision making and order entry.
I really believe pharmacists are an untapped healthcare professional in the correctional environment. And we really look forward to developing more initiatives to reach out to the facilities and their healthcare teams.